Hello, I'm Subhabrata Moitra. I'm a postdoctoral fellow at the Division of Pulmonary Medicine at the University of Alberta, and I'm going to talk about our study on short-term acute exposure to wildfire smoke in association with lung function in a first responder Royal Canadian Mounted Police cohort. In the past few decades, the world has witnessed several long-standing and devastating events of wildfire. A wildfire is a major public health concern because of the high amount of toxic substances and particulate matters emanating from the wildfire smoke. Several studies have shown that long-term exposure to wildfire smoke is associated with increased risk of asthma exacerbation, increased rate of emergency room visit and hospitalization, in addition to its grave impact on lung function decline. However, whether a short-term acute exposure to wildfire smoke is associated with pulmonary function changes has not been studied so meticulously. So in this study, we investigated 218 RCMP officers who were deployed at the Fort McMurray wildfire in 2016. They were screened at Synergy Respiratory and Cardiac Care in Sherwoodburg, and all the officers underwent a thorough pulmonary function test, including a spirometry and whole body plethysmography. We also obtained the air pollution indices from the Athabasca Valley Continuous Air Monitoring Station, and we calculated individual exposure to those air pollutants during the duration of their deployment. In our principal component regression analysis, we found that the air pollution index was not associated with spirometric lung functions, however, exhibited a moderate association with residual volume as observed from the whole body plethysmography. And you can see this in the red boxes in the left panel. Upon stratifying by upon stratifying the association by interval, which is the days between deployment and screening, we found a strong and a higher association between air pollution index and lower small airway functioning in those who were screened within the first 3 months of deployment. In summary, the RCMP officers were exposed to exceedingly large amount of wildfire-related air pollutants over a short period of time. Exposure to wildfire-related air pollutants were associated with a moderate change of lung function. However, changes were only observed for small airways. And after stratifying by interval, we observed a greater association between exposure to air pollution and small airway function in officers screened within the first 3 months of deployment, indicating an acute effect of exposure on small airway function that was particularly observed by a high sensitive instrument such as body plethysmograph. Thank you for your patience.